Hello?
Hello.
Okay. All right, we're just about ready to get started. Sorry, 1 second. I need to mute my phone. Okay. And then we're just waiting on this the Michaela Gray's presentation to upload. It's still uploading in progress, but I'm going to go ahead and just do our little introduction here. So my name is Kate Trams, and I am with the National American Indian and Alaska Native ATTC. And today we have Michaela Gray. She's going to be speaking about specifically more about the transgender community that she has been working with. That it's a support community program that she has set up and is working with. So she's going to speak specifically to that. It's a little bit different than the title we originally sent out, but I think you'll all find it really enlightening and important. So yeah, I look forward to that. And I just wanted to remind people that we will be recording this this webinar today, and if you would like to view it again later or share it with others, we will be sending you a link to the recording. We'll also be we will be redirecting you to our survey at the end of today's webinar. So watch for that. If it doesn't happen to redirect you as we close out today, we will also be sending that survey link in an email that should be coming to you in the next couple of days. And sorry, I normally have some slides that I'm showing at this time, but we're just waiting for this presentation to upload at this time. So I also wanted to let people know that you will be muted for the webinar. So if you have questions or comments, we have the Q&A pod just to the right of the presentation screen. You can ask questions there anonymously. And then if you wanted to comment or chat and interact with us and with those who are viewing the webinar, you can chat into the box that's on the lower right-hand corner. That one is, everyone will be able to see your name if you do decide to put something in there. So we just wanted to let you know that may happen. And if you want to remain anonymous or put a question in anonymously, you can use the Q&A pod. So it looks like we are set to go. The presentation has been uploaded, so I am going to pass things over to Michaela Gray. Michaela she has worked as the Deputy Director for NAPCE, which, let's see, I need to double check my notes for that is the National Native American AIDS Prevention Center in Denver, Colorado. Michaela has also worked on our curriculum team for our Native American LGBTQ and Two-Spirit curriculum. And so she's been a big part of our ATTC. She also went through our Leadership Academy last year, and so we've really loved working with Michaela, and I will pass things over to her at this time.
Great, thank you very much. Good afternoon, good morning, good day to everyone. Ja, ja, Michaela Gray and Shia Kensachin in the slow to come by versus chain, last as a chain here on a dashnella, equator and then So thank you very much for joining me today. I know that we changed the title of the presentation, and you all may have been looking for a different type of content, but this actually could pave the way for another type of presentation that we may access later as a team with the ATTC via this webinar or through individualized training sessions. So I'm just going to do a little plug for this group. But yes, as Kate alluded to earlier, or mentioned earlier, I was the Deputy Director for the National Native American AIDS Prevention Center, and that's still in existence right now, just in a smaller scale than what it has been previously. But nonetheless, we trust that team to continue the work, and so we're kind of an extension of that particular group, and was happy to work there. I currently work with in a different sector now as a clinical research monitor and with a company called Covance. So definitely using a different part of my mind. But I'm happy to be here nonetheless. So let's dive in. Today I'm going to talk about the formation of the National Native Transgender Network. And some of you may or may not be familiar with this network, but here it is. Okay, let me see. Do I have to? Okay. The mission of the NNTN. Let's talk about that first. So it is as follows: to empower the American Indian, Alaska Native, and Native Hawaiian transgender communities through HIV prevention, health and safety promotion, active engagement of communities in Native country and beyond. And so why, you may ask, for what reason do we need this? And so as part of the Native transgender community myself, I've been transitioning now for the better part of 9-10 years. I sat down and chatted with a couple of the community members that I know, and these are some of the things that we talked about. Transgender people are often excluded from important health policy discussions. Health policy discussions around hormone care, whether or not it exists. HIV care for transgender people. Let's see, PrEP medication for transgender people. Basic health care in reservation communities for Native transgender individuals. Transgender individuals are often invisible. And why is that? Because we still endure discrimination, being stigmatized, being ostracized from family members because of the personal decision to take on this journey as a different individual than how we were born. I was born male and decided to embark on a transgender journey 9 years ago. And there have been fumbles along the way. There have been varying sagas, varying obstacles, but also successes along the way as well. Transgender people are often inappropriately represented. And what we meant by this is because we often get people who are speaking about Native transgender experience who are gay men and sometimes not even of Native descent, speaking on our behalf, talking to other people about what we endure as Native individuals and transgender individuals. And of course, transgender people are a substantial risk for HIV. Since I was in the HIV realm, this is something that I hung my head on many a time, and I've talked about many a time. But it also comes to realize that transgender individuals are also at risk for violence, suicide ideation, substance abuse, and alcohol abuse, as well as having other mental health issues that go along with all of that. So balance, harmony, hojo. This, in Navajo, it means, hojo means harmony, it means balance, it means maintaining that. So if my graphics did not translate. But what I meant to put in this slide here was, it's a four-dimensional, it's a circuitous realm, and in it is included the mental, spiritual, physical, and emotional health that we all as Native individuals, Native communities, strive to maintain and keep in balance. And so we do so through ceremony, we do so through taking care of our health, going to the clinic, exercising. We do so through prayers that we may utter ourselves or as a community. So these are some of the things, and going to seek counseling, going to mental health care providers, going to your own health care provider. And I want to hang my hat on the aspect of folks going to the mental health provider as well too, because sometimes during this transition process, it's grueling. Your mind is being switched from being solely male and having those testosterone pouring through you to being somebody who is now where the testosterone levels are decreasing and the estrogen levels are being more pronounced. And how does that take place? How does that, what is the gradual process that takes place there? So nonetheless, this is a graphic that was supposed to show a circle with 4 dimensions in it and all maintained in balance. And sometimes that balance can be disrupted. And so this graphic, should have said, I apologize for this, some of the graphics that I have in my presentation did not translate, where the balance can be put askew, if you will, if the 4 quadrants are not, are in disharmony because of, let's say, on the emotional realm, being impacted by being ostracized, perhaps knowing and finding out that you have a chronic illness or that you have another diagnosis, like, for example, bipolarism or being, or some other realm like that. Having a history of sexual abuse and you're having a history of being victimized, whether it's being stalked, whether it's being actually physically assaulted, that could impact the emotional realm. The physical realm, one of the aspects that I want to talk about there is like having a general distrust of the clinic. If you know people who are working in those facilities, if you know those individuals are of your community and will talk about you behind your back and will eventually get around outside the clinic realm, thus violating HIPAA discussions and HIPAA rules, get around back to you as an individual saying so-and-so or a number of people have been telling us that you are, that's, for example, assuming that you're an alcoholic or that you are promiscuous because you're asking for a ton of condoms when the condoms may not even be for you. So adding all of that to the general distrust of the clinic, it makes it hard for an individual to want to go there for health care. And let's see here. Okay. I so apologize. I really wish the graphic would have translated. Oh my, here's another one that didn't translate. Okay, this is ridiculously crazy. I'm so sorry, everyone. But as part of the discussions that we had as well during that entire process was we talked about how do we as an individual, as the group, now that we've assembled preliminarily, we're talking, what kind of things do we want to focus on? What kind of things does the National Native Transgender Network need to think about? We talked about membership. We talked about community engagement. What will that look like? Community education. What do we want the communities to know? What kind of things as we as a group can we provide to the community for this experience? And for mentorship, we know that there are individuals who do also desire to take on the transgender journey. They may be at different ages than we are, but we have a bank of people who know that process, who are familiar with hormone care and familiar with that journey, familiar with providers who are happy to assist us and provide us good advice and provide us sound health care. We know that information, so why not be available to disseminate that? Because in one way, shape, or form, this whole process of discussion and interacting and sharing happens. Okay, here's, oh Lord, okay, Kate, are you there?
Yes, I'm here. So sorry about this,
Okay, so
Michaela.
I'm so sorry about this. This is a little interesting. I don't know if this is going to work.
Yeah, I
But
apologize.
nonetheless, go ahead. No worries.
No,
I'm
I
just,
was just saying
does anybody,
I haven't had this
I
kind of
changed
trouble
my
before.
screen.
Mm-hmm.
Yeah. I apologize, everyone. This is not what I wanted to see. I'm, nonetheless, the formation. So in early 2013, we decided to have a discussion about how to bring this entire process together. So we decided to formulate, and we were unveiling ourselves at the U.S. Conference on AIDS in New Orleans, Louisiana. So it took a couple of years for us to get off the ground, but in a late fall of 2015, we decided instead to start the recruitment process. Who wants to be a part of us? What communities can we reach out to? We knew of a couple of individuals. Of course, a number of us are from Navajo, so we reached out to those individuals who live there, but we also wanted to think about people who are far and beyond. So we're still in that process. That whole process is still continuing. So although we've assembled, although we have a mission statement, these are all working documents, and these are all working pieces that we're going to finally assemble at some point and unveil to everyone. And nonetheless, this is what's happening. But lately, as the final step in this entire process, we decided to assemble a toolkit that is inclusive of, and I hope this one comes up. Let me see here. First, membership criteria. What kind of members are we looking for? We're looking for individuals who are of American Indian, Alaska Native, and or Native Hawaiian from those communities. We're looking for individuals who are transgender, and they can be at any stage. They could be contemplating the entire journey. They don't have to be ultimately admitting to this or taking on that label themselves. being having active participation, wanting to be a part of this group, wanting to be, if we happen to schedule a face-to-face meeting, those individuals actually want to attend the meeting and to participate in the conference call, and being respectful of each other, because we all come from different aspects. We all come from different realms. We have different tribal histories. We have different languages. We interact differently with each other as well as with the general public. So we needed individuals who had those things in mind, those key concepts in mind. We secured preliminary funding through the Transgender Justice Fund, as well as through the NAFC Indian Health Service Cooperative Agreements. And we were able to do a number of projects because of these wonderful opportunities. And so, again, like any other group, we are still actively looking for additional funding. We're looking for ways in which to continue our various platforms. So this process is constantly evolving. And I'm sure people on this call can appreciate the amount of work that goes into that. So here are some of the core functions. And the core functions are, first of all, assembling a capacity building technical assistance type of presentation. Some of you may have attended this, working with Native transgender individuals in your community. The content including some of the following. What is the definition of a transgender person? Concepts like gender fluidity, gender identity, etc. We also include basic HIV epidemiology and its application to American Indian, Alaska Native, and Native Hawaiian communities. But we're also thinking about incorporating additional statistics from, what type of healthcare issues do transgender individuals beyond HIV experience? For example, what is the retention rate for individuals going in to seek mental health counseling who happen to be transgender? How many of those individuals are there? And what is this, is there a stigma associated with going to your mental health provider, your substance abuse counselor, your sexual, or maybe a sexual abuse counselor, some way, some shape or form? Is there a stigma associated with that? And we also, in this discussion, provide practical tips on interacting with Native transgender individuals. How do you speak to somebody using different pronouns? Like, if you clearly know the individual was born male but now transitioned to female, how do you do that? Or if you want to use different pronouns like they or ze, them, theirs, how does that happen? What do you do? We provide those basic types of tips and such. So in that, we've been able to go to a number of different communities in Montana, Wyoming, Arizona. One of the last places that we went to was Buffalo, New York. We also conducted a mini presentation like this at a transgender summit in Philadelphia, Pennsylvania. So talking about this and giving this to the community and having an active discussion is definitely what we wanted to encourage with this. We are by no means the experts in all topics regarding this, so we rely on individuals who are of that community, who are fairly localized to those specific areas, to help deliver this presentation or help accompany us to deliver this presentation. And we constantly change it and evolve it to make it more applicable to the people who are living in that community. Here's a graphic of the places that we've been. And on average, we've had 10 to 30 providers who are substance abuse counselors, case managers, medical assistants, nurses, some healthcare administrators, folks who are part of the AIDS education training centers have been there, and general community members who just want to know a little bit more about the community that we are a part of. So here's a little group picture of places that we've been. The Northern Arapaho Tribe, of course, up north. The Wyoming AIDS Education and Training Center. You see a group picture of those individuals there. And also we have Nikki Graham showcased on the lower, it's in my lower right, but it's probably a different orientation on your screen. But these are some of the places that we've been and were welcomed into and have had great discussions with. We use an evaluation instrument called a retrospective pre-post evaluation, and we ask for evaluations on the following. What's the content? Is it valuable to what you're experiencing here? Is this what you wanted to hear? What's the presenter like? Is this presenter good quality? Do we need to give this presenter additional tips and cues? Do we need to get rid of this presenter or encourage another one? We also sent out 3 to 4 objectives, typically surrounding HIV, its HIV risk factors, but also just a couple of things we added into as well too. We use a scale 1 to 4, 1 being the lowest and 4 being not at all, or actually very much. So there we had this is what we had. So general evaluation results. Our content seemed to be pretty right on par with what they wanted. Presenters seemed to be great. They were generally evaluated very well. Objectives. Of the 3 to 4 that we've showcased there, some of them had applicability, some of them did not. So nonetheless, we are constantly making this presentation change and evolve and try to make it a little more applicable to the community that we are serving. Some of the general comments that we received, of the most being the most valuable content of this particular presentation, having the res perspective or giving the res perspective. Most of the individuals that we have on the community or the network are of Native heritage and come from reservation life and have that perspective. Just having that knowledge about how to dissect the definition between gender identity, gender fluidity, transgender, the trans umbrella, being able to break it apart and tell people this is what it means, this is how we see it, this is how we see ourselves. But we also offer on that those westernized concepts, the general Native perspective on all of that. So again, a lot of circular diagrams, a lot of talk about harmony, a lot of talk about supporting that harmony, and also sharing our personal accounts, because not all of us have endured the best experiences with some healthcare providers. Some of us have had to advocate very strongly to get what we're currently receiving as healthcare. Applicability. Now, audience members seem to come away with, we now have the tools to begin these chats. We now have the tools to be able to talk to an individual like yourself. And again, we wanted to stress with those dialogues is constantly evolving, just like every other client, professional, community member, family member that you're going to interact with. Improvement, making the training longer. Most of us only typically have 1 hour training set aside, or training time set aside for these particular opportunities. So, and more audience interaction. So in light of that, we've added a couple case studies. And those case studies have been furnished from other presentations as well too. So we definitely try to offer some of those to make sure the audience is fully engaged. Some of the lessons learned, respectful engagement of the audience, using disclaimer statements, and I can explain this in a bit more detail. Use of retrospective and pre and post evaluations, changing those documents as well too. So what I mean by respectful engagement of the audience is sometimes I failed as a presenter to really take into account what my audience was. We've had a couple conservative religious individuals who made comments about, I don't really know if I agree with this particular content, and I think the comments you made about X, Y, and Z were inappropriate. So making sure that I know my audience has been something that I need to work on as a presenter myself, and also something we as a network need to keep in mind. Using disclaimer statements. Okay, I am a transgender individual, and what I'm saying here is, some of it's my personal opinion, but a lot of it is generated from folks who are part of this network, and we feel as a network are valuable to what we're divulging here. And so if we don't mean to insult anybody, we don't mean to downplay any religious experiences. These are things that we wanted to hold and to present here, and we mean no disrespect from any of this information that we deliver here. So some of those disclaimer statements are definitely key in our process. And again, we need to mold these evaluations to fit some of the audiences that we've been interacting with. And sometimes an evaluation is inappropriate. We have to just kind of realize that as well too, because sometimes folks don't want to put down results on paper. It's just their preference, or it's their community experience. Maybe, anyway, point being, taking that into account. So of course, my former colleague Alvin is featured on this photo, and I just thought adding a little breath of fresh air to this would be another discussion. I'm glad some of my pictures are actually translating in this presentation. So, and Kate, I can't see any of the questions, so if you have any questions come up, please feel free to interrupt and let me know. Okay. Okay, balance restoration. So this is a slide, again, that just demonstrated, and I apologize, everyone. I thought these were going to translate. Kate and I thought we had well in hand, but it didn't happen. What we wanted to showcase here, of course, was to show that in doing all of this, in assembling a toolkit, in putting this network together, in talking about basic definitions of transgender, the trans umbrella, gender fluidity, talking about practical tips of how to interact with a Native transgender community, and maybe putting up case scenarios and saying, well, in this scenario, what do you think the provider could have done differently? What are some of the things the provider did well? How are you going to take this experience and apply it directly to what you do daily within your job? So we wanted to, this was a graphic that showed the mental, spiritual, emotional, and physical, all in balance, all being supported by, we want to encourage our Native transgender individuals to seek health care, take care of your body on that level. Make sure you know your HIV status, because that is a huge concern for our community. But also, don't feel like going to a provider, whether it be a mental health counselor, a substance abuse counselor, a therapist of some sort, has any stigma with it. And hopefully you'll find somebody that's really transgender friendly, because that's huge. If you want to talk about some mental health experiences or previous traumatic experiences, you really want to have a provider who knows those concepts, knows the concepts of previous trauma and how that can reverberate over and over and impact an individual's overall health. Supporting, using that concept and encouraging folks to, to do that and to seek out counseling for that. And perhaps with that can also contribute to a more positive emotional health experience for this individual. Being able to seek ceremony, being able to pray, whether it's praying in your traditional tongue or praying in English, doing it within a group, doing it together, doing it within a support circle, definitely could help to support the emotional aspects of this individual. Again, mental health being supported by going to see your mental health providers, and maybe just calling that individual a provider instead of using mental health or behavioral health. And now that we're talking about incorporating mental health, physical, into a whole physical health aspect of your physical exam, that is also another key aspect that can help support that as well too. And spiritual, again, just going to see somebody that you trust as a provider. So hopefully with all of that and supporting all of that and getting our transgender individuals into that frame of mind and helping support that balance and the harmonization, we can see a picture of all of the mental, the spiritual, the emotional, the physical, all in great balance and keeping and secure its harmony. So that's what I wanted to say about that. Some important concepts that we've learned also through this evaluation is the importance of KEH, or the clanship system. The lady one of the audience members that I had last summer in Phoenix, Arizona, said to me, in the way of Navajo, we at home have a certain way of interacting with individuals who are transgender. Yeah, yes, but she said, for example, my grandson, let's say my grandson comes to me, and he is born, and I've known him, I saw him take his first breath, we gave him a name, And so there are ways to address this new grandson that are respectful of his age, of his clan, of his family, of his place in our society. So then as he grows and let's say he changes and he wants to be he feels in his heart that he wants to be a woman, how do I change that? How do I make that accommodation? Because all of it's built on respect. All of it's built on an important key concept within our communities that is rooted in that language, in that clanship way. And I don't know how I can make that change. I'm older, I'm a professional, I'm a grandma now. Is that something that I need to really worry about? And so it's a concept that we as a network are still struggling with. We are wondering how this, for some individuals, it was an adamant yes. You've got to change. Yes, you've got to, call this individual the new pronoun, using even in traditional way, even using those, the importance of using the traditional names, are important to help you formulate that identity. And some of us said, it's an older generation, it's a different generation, and we see that there is a keen respect because sometimes you're always going to be the eldest daughter, even if you transitioned into being male. Sometimes you'll always be the eldest son, even though you've transitioned to being female, and it's just the way it's going to be. Again, big struggle. Don't have a pronounced opinion about it right now or a pronounced response to that right now, but key concepts. Be mindful from our audience how the transgender experience could possibly impact that as well too. Again, some of the, that particular clanship system is established. It builds rapport within the community. It builds your relationships. It's really important. So good things to talk about and struggle with. And here's a picture of the presentations that we gave at the Fort McDowell Reservation. It wasn't through this particular venue of the NNTN, but I just wanted to showcase some couple places that we've been to. So if you've ever been to Nevada, you know what it looks like. Open blue sky, mountains everywhere. So it's real, and desert with chalky chalky white sand everywhere. Kind of interesting. So just wanted to show that. Okay, going back to the core functions. This was a cool graphic that I had there. Some of the previous projects that we've also engaged in are conducting webinars. We had one that was hosted by the ATTC, Mental Behavioral Health Considerations for Transgender People. And I believe it's still available for viewing and for listening to as well. Another webinar that we delivered in late September was called the NNTN and Current HIV Projects. That was and showcased a video that we released for the national, I think it was with the promotion of HIV testing within the transgender community, but if I maybe remember that incorrectly. Okay, so I don't think this, let me see, maybe this will play. It's a My Choice campaign, and hopefully, fingers crossed, it will play for you, but this is what I was alluding to before. Let me just play it.
I'm not sure if it worked for everyone. I had to actually hit play on my screen, so maybe people might all have to individually hit the play button to view this right now.
I've hit play on my side, so it's playing on my end. Kate, do you see the response just yet? In 2010, the Centers for Disease Control and Prevention reported the highest new HIV infections were among ethnic minority transgender people. And American Indians, Alaska Native transgender people had the third highest new HIV diagnoses. In some communities, the trans individual can be invisible and stigmatized. Transgender people people are often overlooked and misrepresented in HIV prevention and HIV treatment discussions. And we know that HIV is present in our health is a complicated series of tests that include hormone therapy, HIV prevention services, behavioral health services, and this is all new territory for many healthcare providers. In order to reduce HIV infection, transgender people must be proactive in requesting routine HIV screening, during routine health visits, and even during community-wide testing events. Okay, so that was a video that we released last fall. So I don't know if people saw that, but it is displayed on the YouTube channel, and we're trying to work on getting it loaded up to our Facebook account. So if you all have Facebook, please look up the National Native Transgender Network, and you can access myself as well as other members of the Transgender Network there. But on the subsequent slide, you can click on it, and it will take you directly to a YouTube page that shows that particular video. And again, we wanted to showcase that, you know, there is a substantial problem of HIV infection, the risk of HIV infection for Native transgender individuals. So please take that and showcase it again and again if you get a chance, and help us promote it. It's definitely something that I am very proud of, and so we've been able to promote that PSA personally in our personal presentations as well as with the network, but also for something that we want to showcase for future opportunities as well too. So we are definitely looking forward to continuing that operation. So I'm sorry if I'm truncating some of your view of that particular video, but with the sake of time, probably need to move on. So, and I'm sorry my cat is here and calling my name. So nonetheless, with this choice campaign, we also unveiled an e-brochure, and that e-brochure, I believe, is still in the possession of the National Native American AIDS Prevention Center. So, if you need to, and I can get a copy of this and forward it to you. But it's a beautiful brochure that demonstrates the colors of the transgender flag, which is why it looks kind of like a baby shower invitation type of deal, but not. So please, I chuckle at it a little bit. But nonetheless, as I alluded to before, under the this funding that we've accrued, or we devised this e-brochure for dissemination. So if you'd like a copy, please let me know and I can try to get one for you. And some of the future work that we wanted to embark on, again, I'm sorry, this isn't the slide that should have had a graphic. Continuing the technical assistance discussions and continuing to assemble more presentations under the umbrella of the network. We have individuals who are transitioning from female to male, and what does that all entail? Because I can't speak to that experience. And also being, how does that identity differ from that of the Native trans woman experience? What type of names should be, what type of things that should we shy away from? Like, for example, the term tranny in our community is very difficult to take. Instead, use transgender, and the person shouldn't be, I can go on about that, but nonetheless, other discussions, other types of presentations need to be put into that toolkit. Advocating, how can we get involved in more advocacy efforts, whether it's through the internet, because the internet is a huge platform now. We need to find ways to do that as a group. We need to talk about how, promoting HIV prevention and promoting testing within our communities, getting people to do so, getting people who are champions in that realm to help encourage that as well too. We also need to encourage positive visibility. Unfortunately, sometimes in some of the communities that we have, our transgender community members are most often seen partying, or people talk about them partying. And so, that being said, we need to find ways to encourage positive visibility where we're in the community, helping the community, serving our roles in the community, and encouraging that as well too. Mentorship, and finding ways to, being available and open to, and putting an open call out there to folks who may be identifying as transgender, and being younger or being older and wanting advice about what to do, where to go, who to see. And so if you yourselves are providers that provide mental health counseling or therapists and are located in different parts of the United States, perhaps near a tribal community, and are open to these discussions and open to providing these services to the community, please let us know so we can start assembling a mini provider network, a provider directory, as it were, and disseminating it to the ladies and men and community members in those areas, and say these are a list of people that you can go to and who you can talk to about various issues you may be facing. We also do the same thing for hormone care. We also do the same thing for provider care as well too. So again, if you have that information and I don't have the information, please send it our direction as well too. Other opportunities, of course, we are continuing the membership. So if you know of, again, trans individuals who are looking for this type of network to be a part of and to contribute to and to maybe help me assemble a presentation that can actually translate between different platforms like this, it would be helpful, because we definitely are not experts in every realm that we promote ourselves to be within. So nonetheless, if you know of individuals like that, or if you yourself are in that realm, please reach out to us as well too, through the Facebook page or through our email accounts. But nonetheless, that's some of the work that we're trying to engage in as well. And I just wanted to say a big thank you, a big hat to the American Indian Alaska Native Addiction Technology and Training Center, but also the mentors who are part of the Leadership Academy that I was a part of, the mentees that were part of that group as well too. Here I have a picture of all of us, and yeah, we spent the year together talking about various projects that we were a part of, talking about leadership experiences within the Native community, but also providing the services as mental health counselors, behavioral health counselors, directors, myself being a deputy director of an HIV prevention organization. How do we now function in this realm now as leaders and moving on to become mentors instead of mentees? I want to say a big hat for that opportunity. And so if you hear of this open call to be a part of this academy, please either recommend good people or be a part of it yourselves. It's very much worthwhile. And I appreciate the entire journey with that group as well too. So once again, a hat for being a part of this. Many apologies for the graphics that did not translate. I promise you, had they been on there, it probably would have made a little bit more of an impact. But needless to say, I believe some of these slides will be available for viewing, right, Kate, on the website or in a recorded fashion. And also, if you need to reach out to me, I forgot to put my email address on there, but you can find me through Facebook as well, too, or just send a general comment to our NNTN, National Native Transgender Network, Facebook pages, and one of us will try to respond as soon as we can. So again, thank you very much, everyone, and many thanks. Have a great afternoon, and I'm open for questions, comments.
Wonderful. Thank you so much, Michaela. And yes, as you mentioned, we will have the recording of this available. And yeah, Michaela, if you want to try and send me, maybe if you want to make a version of the presentation without the video and send that to me, I can make a handout of it so people can hopefully see the graphics that we missed. And I apologize for that I didn't anticipate that not working today,
Neither
so
did
I'm
I.
sorry.
Not a problem. Thank you so much, though. I thought it was going to work, too. I didn't think it was going to be this much of a hassle, but, you know, it happened, so.
Right, I know, yeah. Technology continues to change, and
Exactly.
yes, I apologize to you and to everyone for that little glitch. But thanks so much for giving us a great presentation, and it's wonderful to hear about this network, and I am excited for more people to hear about it and hopefully get involved. So yes, if people have questions, please feel free to submit them now, and we have a few minutes, and then and I'll just remind everyone that as I close out, we will have a short survey. So that should open up in your browser window after we finish up here. But if not, the link will also be included in the email that we'll send out in the next couple of days. So we'll also include the handouts so you can see the slides from today's presentation there and the link to the recording. If you want to view it again or share it with others, we would greatly appreciate it.
Yeah, I was just going to add, if you could do me a quick favor, everyone, if you see graphics or see some concepts on those slides that you may want to use and adapt for your purposes, please reach out to myself on that Facebook page. I may be able to include my email address as well, too, just to let me know that you're doing so. We're just trying to protect a little bit of the some of those graphics in order to be able to promote them on our own discussions within the capacity building platform that we're promoting. So just please let me know. Thank you so much.
Yeah, it's wonderful. And I'll just mention too that we typically send that out as a PDF printed version. So it's not usually something that you can take and use as a PowerPoint directly. So yeah, like Michaela said, if you wanted to use that in some way, it would be great if you asked her directly about that. But yeah, I don't see any questions right now.
Okay.
But yeah, is there anything else you wanted to share with us before we finish up here, Michaela?
Other than the fact that we are available to conduct similar presentations to this that actually do work. So, but nonetheless, yes, we are available. So please reach out to us if you have an opportunity that is somewhat price conscious that we can attend and also disseminate this discussion, or if we just need to have a conference call and talk about it via that venue as well too, we're open to that. I want to showcase one of the network members. Her name is Renee Swoop, and she is a Native transgender woman living in the Southwest who is also another dynamic presenter, and she also delivers a presentation like this as well too. I'm also affiliated with Maddie Jim as well as Nazba Tom. Again, these are all Navajos who I know who are in the transition process as well too, and they also give some excellent presentations. So if you know them and they're near and dear to you, please reach out to them as well too for similar discussions. And I'm just one of many of those wonderful people on that in the network. So yes, that's pretty much it for me. Thank you again, everyone.
Great. Yes, and thank you, Michaela. Yeah, and with that, I think we'll close out here. But yes, thank you to everyone for joining us, and yeah, for this wonderful presentation. Thanks for sharing your experience and this the work that you're doing and that beautiful video. I hope others go back and seek that out. That was a really great thing to see. So thanks again, and I hope you all have a good day.
Have a great one, everyone.